here today to talk to you about the ADVANTA 2 bed and how it will help you with your clinical workflow. It's 8:30 a.m. and I just received a text that we're going to be getting a new patient from the PACU. Let's go ahead and prepare the bed for the patient. First, power cords. You will want to ensure that your bed is plugged into the electrical power. You will see a black power cord that needs to go into your red receptacle on the wall. Additionally, you may see a cream-colored power cord. That power cord is powering the auxiliary outlet that you may have on your left patient foot section of the bed. Please note, when your bed is plugged in, you're also plugging in the battery backup and you're charging the backup battery. That can be used when you're not plugged into electrical power. Some of the controls on the upper rail are going to be helpful to you in caring for your patients. If you need for any reason to lock a control out, you do so by first pressing and holding the padlock button and the button you wish to lock simultaneously. As you see, the lock is illuminated, indicating that that function is now unavailable. If you would like to disengage that lockout, simply push that padlock and push that button simultaneously, and as you see, the light has disappeared. You have features that you're used to on other beds. You have a bed high, low to raise the height and lower the bed. You have a head up, head down control, knee gatch up, knee gatch down. Your bed may have a nurse call feature. If you have the nurse call button on your bed, please make sure that your 37-pin communication cable is plugged into the receptacle on the wall for your nurse call system. Additionally, you also have a scale pod. The scale pod has numerous functions. One of those functions that you'll need to do preparing the bed for your patient is to zero the bed. This bed is a scale, and when your patient's placed on this bed, you want to make sure to get an accurate weight. Please make sure that your bed is not touching the wall, it's not touching any other furniture in the room, and also please be sure that the bedding and other items that are on the bed follow your facility protocol for weighing and zeroing beds. So I am going to enable the key, the green key, push, it will illuminate, and that activates the scale pod. I will then push and hold 0. It will flash a hand signal at me saying, let go. Hands off the bed. You hear that beep. It is now zeroing the scale, and it's calculating, and when the word count goes away, you will see 0.0, indicating that all of your bedding has been zeroed out, so when you place your patient on the bed, you're only capturing your patient's weight. The ADVANTA 2 accommodates patient weights from 70 to 500 pounds. Our patient has arrived. The first thing that we need to do is get an accurate weight. We've already zeroed the bed following our facility protocol. Now we have the patient centered on the bed. I'm going to engage the scale pod, and I am going to activate the green key. Once I do that, I'm able to weigh the patient. I'm going to push and hold the weigh button, and then it's telling me to let go. And it's going to display a weight to us, and it's going to display that weight in pounds or kilos. Right now, our patient weighs 161.7 pounds. I can toggle to kilos by pushing the kilo button if that is what your hospital policy is. Additionally, make note of this weight. The weight will not be stored on the bed to recall later. You need to record the weight immediately. An indicator light on the side rail will tell you if your bed is in the lowest position. As you see right here, the light is illuminated amber. This is an indication your bed is not in the lowest position. When you do lower your bed to the lowest position, this light will disappear. Make sure that you have secured your bed and have set the brakes. There are brake and steer pedals at the head section and at the foot section of your bed in all 4 corners. Additionally, on the scale pod, there is a 30-degree head of bed alarm. This is to help you to support your tube feeding protocols and your ventilator protocols that require head of bed greater than 30 degrees. In addition to the digital head of bed readout, you also have a head of bed display at the top side rail here, and you have a bed level display on your lower side rail. Please note, as I elevate the head of bed, you will see the digital display begin to show the head of bed angle, and as that goes up, I will adjust until I meet my protocol per my hospital, which is at least 30 degrees. And I've got my head of bed at 33 degrees. But as you know, other caregivers and family members may enter your room and make adjustments to the bed. We would like to discourage this for the safety of the patient. In order to do that, you can activate the head of bed angle alarm. Simply press the green key and then press the 30-degree head of bed angle alarm button. One beep signifies to you that that alarm is now set, and you have a visual indicator as well because the green light is lit next to that button. If a patient or a family member or another caregiver comes into the room and lowers the head of the bed below that 30 degrees, you will hear an audible alarm. I'll demonstrate. You hear the alarm, and as a caregiver, you have a few options. As you enter the room, you can disengage the alarm by simply pressing the activation button of the scale pod and turning the alarm off. The other option would be to bring the head back up above 30 degrees to meet that requirement, and the alarm would reset. When your patient arrives and you place your patient in the bed, be sure to align the patient's hips up with the hip alignment indicators. On the lower portion of that top side rail, you're going to see the hip alignment indicators, one on each side, giving you that visual line of sight of where to line that patient up on the bed. This may help mitigate the patient sliding down in bed because the ADVANTA 2 offers a feature called Slide Guard. You will not actually see Slide Guard working. Slide Guard is a frame function. The head of the bed moves back 4 inches, creating a space for the patient. After you've aligned the patient's hips, if the patient is tall, you may want to extend the bed for comfort. The ADVANTA 2 features a 3-inch bed extension. To activate the extension, simply walk to the end of the bed. Under the footboard, there is a lever. Lift up on that lever and pull the footboard towards you. You will feel the bed elongate 3 inches. I'm going to show you how to set the bed exit alarm. The ADVANTA 2 has a 3-mode bed exit alarm. There are 3 sensitivity settings. You choose the setting based on the activity level of your patient. Let me show you those 3 settings. The first icon you will see is a figure in bed lifting their head up. Essentially, this is your most sensitive setting. If that patient lifts their head up, rolls left, rolls right, the alarm will activate. The middle button is the exiting mode. Exiting means as long as that patient is centered in the bed, they can sit up, they may roll over, but as soon as they leave the center section of that bed, the alarm will activate. Additionally, your last mode is out of bed. The patient may sit up in bed, they may sit on the side of the bed. But when the majority of their weight leaves the bed, that will activate that setting. For my patient, I have decided to set the exiting setting. To do this, simply touch the green key and then select the sensitivity mode that you wish to engage. For this setting, I'm going to hit exiting. I know that it is set. I heard 1 beep, and the light next to that icon has illuminated, indicating to me that the patient's bed exit alarm is set. My patient has arrived. I'm going to set the bed exit setting for the most sensitive setting, as this patient has been deemed a very high fall risk. I simply go to my scale pod, engage the green key, and then select the most sensitive setting, which is the positioning. I know that that setting has been set as I hear the beep and I see the green light lit next to the setting that I've selected. The patient attempted to get out of bed unassisted. The bed exit alarm was triggered. As a caregiver, you return to the room and attend to your patient. When appropriate, disengage the alarm by simply engaging the green key and deactivating the button that was alarming. Not only will the bed exit alarm in the room, if your bed is connected with the 37-pin communication cable to your nurse call system, you will also get that bed exit alarm alerting through that system as well. ADVANTA 2 also offers a chair feature. This chair feature can be useful for the patient to sit up to dine, to watch television, or even to position a patient for an upright chest x-ray. To activate this feature, simply push and hold the chair button. Chair button is located right here. Push and hold. When the patient is ready to return to a laying position, simply push and hold the bed flat button. A feature that you have on this bed is what is called vascular foot. So for instance, if you had a patient who had edema or was in shock and you needed to get the patient's feet higher than the level of their heart, simply press and hold this foot up button. And as you see, we are going to actually lift the entire foot section of the bed. And as you see that foot section going up, we're able to get that patient's feet higher than their heart. If I need to get this bed out of this position, I simply push and hold the level button, which brings the bed back to its level setting. Patient controls. Your ADVANTA 2 has a patient pendant. The patient pendant has controls for the patient to elevate the head of bed and to adjust the knee gauge. Additionally, if your bed has nurse call, there will be a nurse call button on this pendant as well. Additionally, you may see buttons for TV and lighting controls. When not in use, the pendant can be stowed in the intermediate side rail. We also have those buttons for patients on the inside of both side rails. Patients can control the head elevation and the knee gauge. There is a nurse call button on the inside of each rail and on the outside of each rail. Also note on the inside of the upper rails are patient storage compartments where patients can store things like glasses or tissues. In the event you need to perform CPR, simply pull the red lever located at either side of the head. You will see the head section will rapidly flatten to enable CPR. Additionally, you can remove the headboard. It can be used as a backboard, or you can utilize the backboard on your crash cart. If your ADVANTA 2 has Safe View, you will notice lights on the end of the bed that shine toward the floor. Green lights are telling you that you have met 4 criteria. Your bed is in the lowest position, your brakes are set, your rail protocol is being followed, and finally, that your bed exit is engaged. If one of these safety parameters is out of place, you will see those green lights turn amber. For example, if I drop the upper rail and we are out of protocol, you will notice the lights flash amber. When you correct the deficit, and I bring that rail back into protocol, you'll notice those lights return back to green. This is a visual indicator that your bed is in a safe state. For your safety and the safety of the patient, please make sure that your brakes are engaged. There are brake and steer pedals at all 4 corners of the ADVANTA 2. The green pedal, if you place it in the horizontal position, is your neutral position. If you place green to the ground, that is your steer mechanism. And to engage the brake, push the orange pedal to the floor. The alarm you're hearing is the break not set alarm. While the bed is plugged into electrical power and the bed is not in a safe locked position, you will hear an audible alarm. When you lock the brake, you will no longer hear the break not set alarm. If you have further questions, please reach out to your local Hillrom representative. We also encourage you to take the ADVANTA 2 e-learning module at the hillrom.com website. Thank you and have a great day.